Well, good morning, everyone, and welcome to the North Strabane Township Community Update. Thank you for attending. Hope everyone is well. My name is Brian Schill, and I'm the Executive Director for the Chamber at Peters, and facilitating with me is Kelly Keene. Kelly Keene today is out of power, so she is monitoring via telephone today. So a little interesting with the storms last night. Just to give you a little background, we are a 501c6 membership-based nonprofit at the Chamber. We don't receive any government funding, and our funding is primarily composed of each member's annual investment and events, or non-events at this point. So our mission is to provide connections, opportunities, partnerships, and resources to grow our businesses and serve our communities, of which North Strabane is one of those. And quite simply, we promote, advocate, connect, and educate. And our area of coverage does include the entire South Hills and Northern Washington County. The Chamber is open, albeit remotely. At times like these, we cannot and will not close because we're needed more than ever. But first, I'd like to thank our sponsor, Washington Financial Bank. We cannot do what we do without our sponsors, especially during these difficult times. Joining us today for our North Strabane Community Update, we have Mr. Andy Walls, Township Manager, Chief Brian Hughes with the North Strabane Police Department, and Chief Mark Grimm with the North Strabane Fire Department.
Morning.
Good morning. Morning. A little Zoom 101. I'd ask everyone to remain muted during the entire update. That will eliminate any background noise, etc. This webinar is being recorded. If you are on, and if you look at the top right of your screen, you'll see a little gallery button up there. That'll allow you to see all the players that are with us today. So that'll help you out. Our format today, basically, I'll be moderating with some discussion with our guests, and time permitting, we'll follow up with some Q&A. If you have a COVID-19 related question, you can use the chat box at the bottom of your screen and type it in, and then we'll address it from there. So, Andy, let's start with you, sir.
Absolutely.
You're on, sir. How about just a brief update on what's changed since the COVID-19?
So, I mean, I'll say this. Thanks for having us, Brian. I appreciate this opportunity to talk with everybody, and I know the Chiefs do as well. What's changed? I mean, I'll be the first to admit I was maybe one of the people who didn't take this as seriously at the beginning of March as maybe we should have. But I can also say by mid-March, I would say that we completely changed how we were operating here in the township. Whenever the president, it was a Wednesday, I think, in mid-March, kind of started to issue some guidance, and the NBA shut down and the NHL shut down. We immediately kind of sprung into action. We have a host of employees that are working from home and did work from home, and quite frankly, some that we just paid to stay home for about a 2-week period, just trying to comply with those social distancing guidelines and making sure that our employees were safe. Initially, we did have our front doors open. That has changed since then. Our front doors have been locked for a couple of weeks now. Like I said, we do have a number of employees that are working remotely. Unfortunately, given the slowdown in the construction business, given the temporary closure of the casino, some other things, we just don't have as much work being done here at the township. So this past Monday, we did furlough 12 employees. And we're hoping, and the plan is to bring them back here once we get through all of this. And those ranged from code enforcement to public works and on down the line. It did not affect our police or our fire departments, as we know that they're vital to fighting this pandemic. So we're doing a lot more work by mail. We're not letting residents in, and really things are being done digitally more. We are still allowing residents to attend our meetings, but we are also giving them the option to participate via a call-in line via the phone.
Excellent.
Yeah.
How about garbage? What's changed with garbage?
So the only thing we're in a agreement with Waste Management. So the only thing that's changed is that they're not picking up bulky items, any items that they would need 2 men on the truck. My understanding is they've gone to a 1 man on a truck operating system. So to better social distance, to stop the spread of disease. I think we can all agree that if the garbage industry would be struck with a number of cases, that could be devastating, especially with people being home for 3-4 weeks at a time here. I know that the diaper output in my house is off the charts right now. So I couldn't really imagine having to live with that for a month-long period. So the garbage men are doing a great job. I would ask everybody to have patience with them. You know, they're going to come back around and get everything done. So they're not doing multiple things. If you have your garbage in your can, your recycling in your can, it's going to be picked up. If it's outside your can, it's not going to get picked up at this point.
Yes, sir. We may have talked about it briefly, but how about the status of some of the township projects? Anything going on at all? Anything?
Well, it's really it's really a maintenance at this point. We do have a project where obviously we're trying to build a 3rd fire station. That's kind of been put on hold for not just the COVID-19 related issues. We're having some other DEP issues with that, but you know, obviously if we got all of our approvals at this point, we'd still be on hold due to the delay in the construction industry. So that's happened. We are taking a really hard look at our capital budget. Our capital budget is primarily funded via the revenue that we receive from the casino. And obviously the casino has been closed now for going on about a month. We're working, I can tell you, I've reached out to Representative O'Neill's office. They're very helpful. They're trying to help us determine what type of revenue we might see here coming into the beginning of the year, since the casino was open for the first 2.5 months of the season. But we are meeting. We're talking about scaling our road paving program back. We're talking about we were going to try to put a deck hockey rink in our park. We're scaling that back. Our public works department needed some renovations done just to kind of bring it into the 21st century. Unfortunately, those look like they're going to get cut, at least at the moment. We're really just taking a hard look, and I'm having a meeting later this week with our department heads to talk about general government spending as well. As I said, we did furlough several employees. We're thinking that's going to help us get through some of this. But I will say that I believe that the bones of the economy in North Strabane are still strong. My understanding is that basically landscapers everywhere are going crazy busy. So people obviously have some disposable income at this point to spend on that. People are still, I can tell you, are calling about buying homes when this is over. We're still getting positive feedback from our builders that they're going to continue to build homes. So I think the bones of the economy are strong, and I think if we're able to come out of this by June, I think people are going to get back to work, and I think we're going to be looking good here.
How about comments regarding the stay-at-home order and what you guys are seeing out there?
I mean, personally, I do get calls. I mean, our park is closed. We're not in a situation where our park is really trail heavy. I would not really say that we have anything that I would officially classify as a trail. We have, a number of pavilions. Obviously, we had rentals beginning at the end of April. Those have all been canceled at this point. We have a number of rentals for our ball fields. Those have all been canceled at this point, kind of indefinitely. That's been something. We do get calls about people who want to go up there and walk, and unfortunately, we just have the entire park closed down. Obviously, with the schools closed, with the libraries closed, people are looking for things to do, even given all the directions and guidance coming down from all levels of government. And but our park is closed. We just don't want to risk having the spread on our playground equipment and our pavilions. And quite frankly, we don't want to put our employees at risk of coming into contact with people who may or may not be exposed to COVID-19 at this point.
Okay. Does North Strabane have any type of helpline set up, or what would you recommend for residents?
People are just calling our number. I mean, like I said, we're very minimally staffed at this point. The 724-745-8880. You're going to, more than likely at this point, I'm answering the phone. So, it's a good, we're here, we're answering questions. We have some code enforcement people, one person in the office at this point. We have a skeleton crew in our public works department. So if people do call, I mean, I would hope that it's for something that really needs to happen now, because we're really, like I said, we're running very much bare bones skeleton staff at this point.
Okay. Any initiatives that maybe we haven't talked about that North Strabane is working on or that is doing relative to COVID-19?
Not particularly for residents. Again, we're just trying to keep the number of touches between people to a minimum. You know, it's meeting. We're here. The government's, you know, as operational as it can be. And I can say, you know, the fire department and the police department are doing a lot of great stuff, and you know, they're answering questions every day as well. So we're all here. We're in this together, and we're moving forward.
Before we move on, any other comments that you'd like to make maybe we didn't cover with you?
I would just say, you know, in the last couple of days, we've started to see some, I think, positive data associated with this. I read a lot of articles from Italy to Seattle and everywhere in between about this every day. You know, I would just kind of urge everybody not to get too excited about that, and not to say, hey, it's time to go out and, you know, have play dates and everything. I'm excited about it too. I literally can't wait until the day that I leave the office and people are playing baseball on the fields, and, you know, I can go home and I don't need to, you know, basically take off all my clothes before I can give my kids a hug. So we're not there yet. I think we're going to get there given some of these positive steps, but we've got to keep strong and keep moving forward.
Excellent. Thank you. Chief Hughes, how about what are you guys seeing? Give us a little update on what you guys have at the police department.
Oh, good morning. As far as what we're experiencing right now, I did a snapshot of the last 4 weeks and what the previous 4 weeks were like last year, and to compare our call volumes. And it's obvious that our call volume has decreased, but I just wanted to get some more solid stats. Our call volume has decreased by 80%. Our arrests are down by 50%. Our accidents are down by 60%. Obviously, for the stay-at-home order is having an effect on that. And our disorderly conduct disturbances and calls for suspicious people are basically holding steady, maybe slightly elevated. But for the most part, everyone seems to be complying. Like I said, that's obvious by our call volume. And there seems to be a lot of cooperation from people. We've only had to check on 4 or 5 businesses when the non-essential order came in for businesses. And out of them, we only had to give 1 warning. So, you know, I think that's a high degree of self-compliance where we didn't have to get involved with. So I was very happy with that.
Okay. How about, has this changed any of your operations regarding day-to-day ops? I presume, I think Andy mentioned that you guys are still full staffed. Anything you guys are doing different out there in the community policing or anything like that?
Well, as far as how we're operating, our main lobby where people come in to get copies of reports, accident reports, or so forth, or to see officers, that lobby has been closed for weeks now. We installed a doorbell on the outside, so when people, if they have to come to the police station, they ring the doorbell. There's an officer that's in the station from 8:30 to 4:30 Monday through Friday during business hours. That officer will come outside and meet them outside and not bring them into the lobby. And so when they go outside, they keep the 6-foot rule of social distance in mind and obtain whatever information they have to get, or if they can help them, whatever they're there to talk about an officer with. So that's changed because our lobby's closed. The other thing is there's some personnel that we have, as the manager previously stated, that are working from home. Even though our call volume is down, as far as administrative work, that's still going on. That doesn't stop. So we're fortunate to be able to have the ability to remote into our servers and use, take home laptops. And so that we haven't missed a beat as far as that's concerned. As far as community policing, that's down to a bare minimum. A lot of officers, when they go on calls, they've all been issued an N95 mask. They all have gloves. At the beginning of this, the N95 masks were extremely difficult. We actually have enough right now to issue 3 to every officer. So far, they have 1. They use that and we issue another one. But so officers are taking precautions when they go on calls. Depending on what it is, some of them will put a mask on. Most always they have gloves on in case they have to get hands-on with somebody for whatever reason. When we do respond to calls, we're asking people to see if we can settle it over the phone. If not, if we have to respond, we're asking them to come out of their house or their business or wherever they're at and speak to us outside instead of us going indoors. That's also a safety measure that we're doing. It's different. It's really different as far as how we're dealing with people and trying to provide a service. But so far I think it's working. We had a couple officers, their family members exhibited some signs of COVID-19 with fever and cough, and I self-isolated them at home for a certain period of time. And so far it doesn't seem like anything that's spread through the police department. If anything, we've learned some really good things as far as cleaning products and how to keep the station sanitary, which is going to come in handy because last year we had 2 bouts of flu that ran through our station, and it was so bad at one point that basically just the people that were scheduled to work for like a 3-day period, there was no one else to work. Everyone was out sick with the flu. And so I think if we would apply those same measures that we have now, not necessarily with the mask, but just staying away and cleaning everything as best we can constantly, we might have had some fewer illnesses back then. So that's something positive to take out of it.
Absolutely. I did see on Facebook that Senator Bartolotta brought some N95 masks that were, I guess, donated by Equitrans. Were those to you guys, or was that to the police department or the fire department?
Yeah, some of the area chiefs, we had a conference call with her and just to talk over some of the what's going on in related to this COVID-19 incident. But we expressed some of our concerns to her, and she came through with a lot of N95 masks yesterday. Actually, my department got 30. We got gloves and some other items too. And I want to add, there's been some private businesses that have come by and dropped off. Just yesterday, one of the things we're trying to get hold of is hand sanitizer. So hard to come by. And Chrome Bank stopped and gave us 3 huge bottles of it. So that was a lifesaver. And there's another company that's been providing face shields, PPE Pittsburgh. They've been providing face shields for first responders. And, I was able to get 25 of those and issue 1 to every officer to protect themselves. So still a little difficult getting some of the gowns in case we have to assist the fire department or EMS with a patient, where we have to actually get hands-on. That's still difficult to come by, but we're doing pretty good as far as other supplies right now.
Excellent. Now, if someone needs to get in touch with the police department, because different police departments do this in different ways. If it's an emergency, I would presume it's 911. How about non-emergency?
Yeah, non-emergency, it's just the 724-746-8474.
Excellent.
That's our emergency number. I'm sorry, our non-emergency number for the office. Somebody will answer that phone Monday through Friday between 8:30 and 4:30 p.m. Okay. And also we have someone still here at the station, like I said, to handle any complaints that people have. But we would really strongly advise that they call us first to see if we can handle it over the phone. And one other thing, Brian, I just wanted to mention that you know, in every major thing that happens, there's always good and bad that you see from people. And unfortunately, one of the bad things is there's been just a severe, extreme uptick in malware, ransomware, viruses, business email compromises, network intrusions, and all that stuff. There's been a big uptick in that, and I just want to extend to, you know, businesses in our community that if they want, they could have their IT people or themselves send us an email, and our email address is this is just for high-tech crimes. It's Hotel Tango Charlie at nstpd.com. That stands for, obviously, North Strabane Township Police Department.com. So it's htc at nstpd.com. If you send an email to that email address, any phishing scams, ransomware that comes up, we will send you information on that periodically to protect your system. We're only one of less than 100 agencies that can investigate network intrusions. So if a business is compromised by either some state-sponsored hacker that either wants to take their information and publish it to embarrass them or wants to hold it ransom, we can investigate that. So I would highly advise businesses to not just accept it, to call us. However, I do want to say that if you've already been compromised, the chances of you getting your information back without paying anything are still low. I don't want to be optimistic on that. It's still low, but you know, if you do have something like that, we can help.
Thank you. I just put that in the chat box for everybody. The HTC at North Strabane Police Department should be .com rather than .con, so you can you'll have that there. We do have a question from someone. They were asking you to address the essential business, and do the employees need to carry the governor's letter, or what is the protocol?
As far as the essential businesses, we have access through our Justice Network. It's called JNet, but we just log on to a network, and from that network we get access to criminal histories, labor industry information, and so forth. And along with that is information from the Pennsylvania Department of Community and Economic Development. They have a list, a current list of all businesses that have been approved, any businesses that have submitted an email for an appeal to be heard. That's also there if it's in queue, and if they've been denied, that information is there also. So we're able to assure that the information we have is correct. And if they tell us, hey, you know, we applied for a waiver, and we can look and see if that's correct or not, what the status is. The only difference right now is that childcare and daycare, they go through a different process, and they have to apply through the Pennsylvania Department of Human Services, not the economic, I'm sorry, the Community and Economic Development Department.
Is that JNet accessible to the public?
No, that's
okay.
Just law enforcement.
Excellent. Anything else we didn't cover on your side, Chief, that maybe we should chat about?
Not really. It's just that, you know, our efforts, you know, Route 19 is a main route, and our department does do a lot of traffic enforcement on that. And since the stay-at-home order has been in place, you know, obviously, like I said, our traffic accidents have been reduced by 60%. So I think everyone that does venture out to go to the doctor if they have to, or the grocery store or whatever, they can tell that the traffic is very light. So we've been focusing our efforts mainly on neighborhoods, what we want to do. Even though everything is down right now, we all know that there's a shelf life to that, and we're expecting an uptick. Just don't know when that's going to be. But we're just trying to stay vigilant. Just ask residents in the township to do the same. If they see something suspicious or somebody suspicious, call us.
Thank you. Thank you very much, sir. Chief Grimm, the floor is all yours.
Okay. Well, I mean, obviously, as the manager and police chief also discussed, our call for service are down pretty much half. But the one service that is still remaining constant is our EMS. We're an advanced life support service that runs with Canonsburg EMS, and obviously, with this pandemic, everyone that maybe think that they have something are calling. So we're taking a proactive approach with that. One of the things that we're still reaching out to all of our nursing homes, churches, even though they're closed, and hospitals on a weekly basis, just to see if they need anything, if they have anything that we need to know about, so we can get to the first responders for the township. But it's just, I think this pandemic, it's new to everyone, whether you're in the public or private sector, and I think everyone is learning as they go. The one thing within the township, we meet weekly, so we're constantly sharing information between all departments, and it helps us because, like I said, everybody's learning as they go through this.
Okay. So how is this affecting your staffing for fire calls, et cetera?
As far as staffing, we're still for a full-time staff of 15. We're still ongoing. We did limit our part-time because our call volume is down, and we're working with our volunteers that we only want them responding on major incidents. The idea is to keep social distance within the department, but also the public. So if we need them, we'll bring them in for help. The fire stations are pretty much locked down. They're sanitized twice a day with the equipment. And, it's just call volume's down. It's just, like Andy said, I think everybody's waiting for this to break so we can get back to life as normal.
Okay. How about the health side of this? What you're seeing, PPE, things like that?
PPE, I mean, we're right now, every full-time member is issued a N95. We're following the CDC guidelines with the health department as well on to try to get the most amount of use you can out of it. Obviously, if we're exposed to a patient that tests positive, it's disregarded. But we have the N95s, as Chief Hughes alluded to. We also were able to get some face shields, Tyvek suits. But one of the things that the gowns are hard to get. We actually went to a Dollar General, and the CDC will allow you to use just clear ponchos. So it actually works out better for us because, with the Tyvek suit or a gown, it takes some time to put on, and, whether you're, fire or police, you have gear around your waist. The poncho you can just put right over top of it, and they'll accept that. So we were able to get those yesterday. But, like everybody's pushing, trying to get the N95s. I mean, we're trying to project 8 weeks out. We're not there yet as far as equipment. And with the governor's request, when we're out in public, to have some sort of shield over your face, that's kind of what we're tasked with now. There's a memo going in place today for any non-emergency runs we're on. We want all of our personnel to try to do our part. But we have a few residents within the township that have called. They're making shields for us as we speak. But I've been in contact with Representative O'Neill, who's been a huge help, information sharing. So we're working with him to try to get some stuff as well. But at the end of the day, it's scary times for everyone. And whether our department or the police department or any other department up and down 19, one person gets infected, it can very easily shut your department down. And I think we all strive to give the residents the service they deserve. But with that, I know on the fire side, the whole 19 corridor, we meet weekly via Zoom or phone calls to see if anybody needs anything. We're just trying to, at the end of the day, I don't think anybody wants this, and we're just trying to do our part. If not only in North Strabane, if we can help any other surrounding departments as well.
Excellent. How about what can the residents or businesses do for you? You did say a couple stepped up and for like one of them for masks or something like that. Anything else you can think of?
I mean, if any residents have access or they have any N95s or any surgical masks that they're willing to donate, we'd be grateful to get them. I mean, obviously, I think if anybody had a crystal ball, but we don't know. We're hoping to, for the end of the month that, but they're saying it may go into May. So any material they can donate, we'd be grateful. But, again, it's just, that's the $1 million question. When's it going to end?
I guess one good thing that the residents and businesses could do if able is stay home, I guess. That's probably one of the biggest.
Yes, that is. It's huge. And yeah, that is a good one just to stay home. I mean, being right on Route 19, it's kind of funny. The guys, once a day, I mean, a couple guys will go out and do some laps in the parking lot just to get some exercise. And, one day you won't see any traffic. And, next day you'll see the traffic fluctuates, but traffic is down. But, and you bring up a good point, because that's one of the things that we had to adjust, answering a lot of medical calls. We wear a mask and eye goggles on any EMS call just as a precaution, but yet you also, if you're going to a resident's house, I mean, they just, we try to do a good job through our social media site to explain how we're dressed, why we're dressed. But at first it was a little insulting for, but I think now that everybody's getting it. And, but that's a very good point. Just stay home. You don't need to be out.
I know we did this yesterday with Peters, and one of the things that came up was the library, for all ages for that matter. They have a lot of resources available out there, and I'm sure the other libraries as well. I mean, there's all kinds of, someone also told me about like the Khan Academy. They use that a lot if they ever have a question. So, but it's all good. Anyone else have any closing comments? Let me see. We do have. Okay, here's one. Here's a question. What about homemade masks? Can the department use those?
Yes, and that's a very good question. One of our residents is actually, she took the, as long as from the CDC, she actually took the paperwork and she's making those as well. And so that we will definitely take those as well.
Excellent. I don't see any other questions from anyone. Any last comments from our panelists today?
I just want to say stay home, stay safe, and we're going to get through this together. Recognize that we're all just trying to do our jobs at this point. I think, one other thing I've been thinking a lot about recently is, when we do get out of this, for people like Chief Hughes, Chief Grimm, and myself, who've kind of been in the middle of this for the last, going on, month, going back to normal is going to be a little different too. So I welcome it. I'm excited about it, but making that transition, I think for all of society, I think you're going to have 90% of people who've been stuck at home for a while and ready to just get back out and do it and completely appreciate it. But, recognize that some of us are going to be a little tired whenever this is all said and done. But we're here to do our jobs, and we're doing what we need to do. We love our jobs. All three of us are committed to serving the residents here and just keeping everything going and operational. And we're keeping everybody safe, and we can't wait to actually shake people's hands again and see them at the parks and in our meetings and at our different events. So we're excited about it. But everybody just needs to hunker down a little bit more, and we're going to get through it together.
Thank you. I don't usually do this, but I'm going to put someone on the spot if they wish to comment. Representative O'Neill, I thank you for being on with us as well. Your name was mentioned several times, so I thought we'd see what if you had any words for us.
Well, I certainly appreciate you putting me on the spot, Brian. Chief Grimm and Chief Hughes. It's really important that we come together as a community to address the crisis. We're at the state level. The governor's office is is coordinating the day-to-day efforts to address the crisis. The legislature's role in it has really been looking to the future, to to talk about the plans, to ensure that communication is done here in the moment, here locally. I've been working with, as you heard, several of the people here in order to ensure that we not only have information throughout the community, but we have the resources we have as well. One thing people need to keep in mind is it's extremely fluid. Information, as we've all seen at this point, what we thought was a good idea or a bad idea. A good example is the cloth masks out in public. 2 weeks ago, we were saying it's not needed, it's not necessary, and it doesn't help. Today, we're saying everybody should be doing it. So information continues to be updated on a nearly hourly basis as we learn more about the crisis, as we learn more about the situation across really globally. So I would encourage people to be patient. It's very fluid. We understand there's a lot of confusion out there. The biggest issue that I'm dealing with on a daily basis here as of right now is unemployment claims. Unemployment claims have skyrocketed. We're over 1.2 million statewide. And just want to encourage people to have hope. We're going to get through this together. I agree. I'd echo what Andy just said. Stay home as much as possible. But have the optimism that there is light at the end of the tunnel. We're going to come back from this. We're going to recover, and we're working on a plan to do just that.
Thank you, kind sir. Especially in the light of me setting you up like that. So I just want to add, first of all, a thank you to everyone, to all our panelists today. A lot of folks have, at the end of their emails, et cetera, it says, be safe, be well. But the other one I don't see as much of, but I do see is be kind. And I think that's also a good one. Just to close up here, I just want to let everybody know the chamber, again, is open for business. Our physical office at Waterdam Plaza is closed, but email is best. And it's the same email you registered as, info@ptcoc.org. And our phone number is 724-941-6345. We do check that at least twice daily. We have a new Facebook group. It's called the PT Chamber Community Support. Basically, it's COVID-19. If you want to update your hours, anybody can get on this. It's not just for chamber members. So you'll see businesses are posting, hey, this is what we're doing this week. That's what we're doing next week. Just updates on resources that are available. You can also keep an eye on our regular Facebook page and our website. And then if you are a member, you'll just please take a look at the emails that we send out. Tomorrow we have a similar update with Bethel Park, if anyone would like to join that one. Next Tuesday, we've partnered with Washington Health System. We will have the Chief Medical Officer, Dr. John Six, with us from Washington. And then, so if you want to check them out or sign up for anything, you can go to ptcoc.org. Again, I'd like to thank our presenters, thank our sponsor, WashFi, and all of you for attending today. Stay well. Have a good day.